Hi everyone, I am Dr. Swayam Prava Baral and today's topic is mental resilience. How to be resilient in your big goals. I'll tell you, in my journey from clinic to the crown, I have always been very ambitious, been behind big goals. To have big goals, to have big ambitions, and to manifest them into reality, you have to have a certain kind of mindset. So today, in this long format YouTube video, I'm going to give you a sneak peek of what all I did and how I somehow achieved all my big goals with a definitive strategy. Hello, I'm Dr. Swayam Prava Baral. I'm a psychiatrist, Bhubaneswar. I'm a WHO Fights influencer, Mind Valley coach, and also TIGP Mrs. India 2024. I'm going to represent India in international platform this year. The announcements will be made soon. So how could I achieve so many big goals? The secret lies in mental resilience. What all tricks of resilience I used, I'm going to tell you through a story. I moved to Odisha after I was working as assistant professor of psychiatry in the most reputed Central Institute of Psychiatry. That was COVID time. It passed somehow. It was a very tough time for doctors. As you know, so many of my friends passed away. It was very tough for all of us because we had to deal with COVID patients, and many of our friends were contracting illness, many family, relative. Overall, it was tough time for everyone, but for doctors, it was a nightmare. After crossing the time, COVID was over. I was doing my assistant professor. I was teaching. I was seeing patients. Then I got an opportunity in my own state to join in Puri, Sri Jagannath Medical College, and I was so happy that this was the first job I got in my state. I was trying to return back to my state since like 15 years. I did my MBBS in MGM Indore, I did my DPM in CIP, then I did my MD again in MGM Indore, and I did bond in a rural place, and after that I was working in CIP. So it was long years outside, and I wanted to come back to my place. When I got that job, I came back. So that was a very bright phase of my life, and I was about to get married, and I got engaged and I got married the next year. Then eventually I got an offer from TIGP. I saw something, I don't know, I saw through Instagram or some friend referred to me, I don't exactly remember it, but what happened is I got enrolled in Mrs. India, and that was the time my husband was posted in Raurkela and I was staying here. I was in Puri, I was working in Puri, I was in Bhubaneswar, so nothing was very organized in my life right now. I thought at that time that nothing in my life right now is organized, so let me just take another step, something adventurous, something new, something novel. So I thought, and I enrolled for TIGP Mrs. India 2024. I don't know that would change my life so much, but that was just one adventure thing that I enrolled in. So my routine at that time was very hectic. I had 3 OPDs in Sri Jagannath Medical College, psychiatry OPD every day, 40 to 50 patients. I had to take care of the students, I had to teach the students as a faculty, and also I was traveling back and forth from Puri to Bhubaneswar, like it takes around 1.5 hours, and sometimes driver was there, sometimes most of the times driver was not there. I had to drive my own vehicle myself. So life was already tough, but then I took this challenge because okay, my husband was not there, so I thought, let me utilize the timing somehow, because I am a time freak person. I never waste time. Whatever time is there, I think something productive should happen. This has been me my whole life. I think that is the reason I have been so successful, because I have always valued time. I never waste. I cannot waste even a single day. So that was something I thought, this is utilizing my time. And also at that time I was doing my fellowship from JSS Medical College. I was doing my fellowship in psychosexual medicine, which is a very emerging, prominent field. So everything was going on, and along with this new adventure started. So at the time I was not looking like this. I was little chubby. So a lot of the shiftings, the changes, the marriage stress, everything, I put on a little bit of weight. Then I went to the first boot camp, and there I interacted with a lot of people from different backgrounds. That kind of made me I was already a very enthusiastic person, and interacting with many people, many friends from different categories, all with the aim of self improvement. I really loved that experience, and the exercise sessions by our teacher, our guide, Dr. Swarup. He's a dentist and he's the co-founder of TIGP. Dr. Akshata and Dr. Swarup are the founders of TIGP. So meeting with them, I was very excited to look forward to whatever this journey is going to unfold. Then I came back, and as my busy life was going on, and this is about, this I'm telling you about September 2023. Along with this new avenue, also I started another project. I had a long run dream of establishing my own clinic, that is Swayam Mind Clinic. The name was fixed from 2014. I always had in my mind that I wanted a Netflix styled clinic. So this is the clinic right now. I am sitting with this beautiful background, and so that was a phase when I decided both. Already my life was very busy, but I decided both for going for the Mrs. India competition, and in September we talked about the clinic. What happened, I'll tell you the clinic story now. Then in October I established my clinic. There was this space in UD City Mall above Boca Cafe that I liked a lot. So digressing from the crown story to the clinic story now. So that space, this is not the space, this space is the side one. There is a dental clinic now. So I, being a very highly ambitious woman, I wanted that space only. I thought कि if I'm going to have a clinic, that has to be ultra sophisticated, that has to be a future vision, that has to be a Netflix styled psychiatrist chamber that I always loved. Because psychiatry is not only my branch, it is not only my passion and my profession, it is a spiritual journey from me. Everything related to psychiatry, to my profession, is something that I deeply love and admire, and I do it with a lot of passion. So I wanted my clinic to reflect my passion. So what I thought is, this is the space, the glass space that I want. But that was too costly. So discussing with everyone and all that, why will you do so much of investment, what is the need, this, that. So discussing with a lot of people, the plan dropped out. This was 2-3 months back. And then again, when I was passing through the road, and I saw one day, my brother and me came for a tea, and I saw one day that space is taken up by a dental clinic. That day I was devastated. I was seeing somebody else living my dream. So the question came to my mind, why not I? Why can't I do it? So I was sad, I was teary. So my brother said, let me give up a call if there is any other space available in the same building, in same type of space. So he gave up a call, and luckily this space was being vacated in a month or two. MMT was here, and it was about to leave. So that day I decided, no matter what is the amount of risk, no matter whatever I have to do, I am going to take this step. In certain times of your life, you are at a crisscross between your imagination and practicality, between your future vision and your current reality. So at that time, everybody around you will tell you to stick to your current reality, but some elements of future vision you can adhere in your current reality. So I took a very bold, risky decision of going with the clinic. So we took the clinic. The rent was obviously high, the rent is high, and that time also my salary was less than I'm currently I'm associate professor, I'm promoted, so now it's good for me. But that time it was very difficult for me, but I wanted to go with it anyway. And by Lord Jagannath's grace, I didn't expect that this will go so good. After establishing my clinic, we did the interiors, me and my brother. We were very excited about that. That time my husband was not here, he was in Raulkela. He was in high-tech medical college. So I was, at the time when I took the risk, I was all in. We designed everything. We designed from the backgrounds, what table, what chair, everything. And I started seeing patients, and thank God, the response was so good. So many females who were searching for a safe space, they came to me and they were so satisfied, and they told that thank you ma'am for creating this clinic, because we could have never found such a safe space. The demand of a female psychiatrist is very different. It's a very emotional one. When the patients, they are treated and they come to you and they thank you, it's a very emotional moment for the doctor. And it's not only about your profession, it's about the impact you have in a society, the patients you treat, the lives you transform. It transforms their lives and the lives of their entire family. So it's great work. Nothing can beat the satisfaction of treating someone who is mentally unhealthy and beginning their mental wellness journey. So I wanted a space where I wanted to incorporate not only I didn't want only to cure mental illness, I also wanted to start mental wellness. So whoever patients come to me, I inspire them to start their wellness journey. It's not about only curing your illness with medication and therapy. It's about changing your way of life. It's about changing the lifestyle and starting a mental wellness journey. I recommend them, I give them my book 30 Days to a Healthy Mind, and I ask them to go through it. I recommend them different workbooks. I give them different worksheets, different kind of modules to apply, so that they can begin their wellness journey. For me, it's an individual whom I'm going to transform. That is my purpose of life. Because as in a recent talk I told, when your passion is combined with compassion, that becomes the purpose of life. My passion is mental health. Compassion is all the people I treat, all the lives I transformed, and when it is combined, it becomes my purpose of life, that is transforming lives around me. So this is about taking big risks, and when your purpose is clear, when you can only take the risks when your purpose is very clear. My purpose was very clear, to transform the lives of people in Bhubaneswar, especially the women, those people who are not getting an appropriate place for their healing journey. So my purpose was very clear. I saw the unmet need and I tried to meet it. So this was about taking big risks. So that was going on, and along with that, in 2024 I had to go for the Mrs. India competition in May. So before that, there was 1-2 camps where exercise and diet and everything was going on. So I tried to transform myself. I tried to do exercises. You know how hectic medical field is, how hard it is to find time for anything. And my routine at that time was to and fro from Puri 2 to 3 times, and so many patients and so many things going on in my life. I was newly married, etc. So still I thought, no, I am going to do it anyhow. So I did exercises. I really transformed myself. I lost around 5 to 7 kgs. The people who see me, they think that I have lost a lot, but actually it is just 5 to 7 kgs. When you start doing these things, people have various opinions about you. They have very stringent ways of judging you. So many people who are like, what was the need of the spotlight? Why do you need to go to a pageant? You are already an established doctor. What is the need? What is the need? What is the need? So many questions people used to ask. So my need was very clear. I wanted growth in some or other form. I need constant growth. My rate of self-evolution, as Bisan Lakhani calls it, ROEZ, rate of self-evolution is very high. I want something new. I want something growth in my daily life. So this pageant was a way of growth. Pageant is not only for beauty. Pageant is not about beauty. Pageant is not about looks. Pageant is about your personality. Pageant is about leadership. Pageant is about connections. So as a women leader, as an advocate of mental health, it was a very beautiful way of enhancing my impact, the already established impact, and reaching even more people, forming even more connections. So I really loved the concept of pageant. When I participated in Mrs. India, when I interacted with those kind of people from different backgrounds, I really loved. It took my leadership skills and my networking skills to the next level. I'll tell you a small story before what happened before the pageant. I contracted hepatitis I had hepatitis before that. It is a very bad illness. I was unable to eat, I was unable to sleep. Those 14-15 days in April and May was the competition, and in between that also I went for a camp. And do you know what inspires you to to go towards your goal despite of having illness, despite of having setbacks? It's your inner resilience. It's my inner resilience that has helped me always. If I want to do a thing, I will do it at any cost. Success is your journey. It is your journey ultimately. There will be a lot of connections, there will be a lot of help, but ultimately you will have to do the work. So when I was in hepatitis, when I was in illness, and everybody else was like, no, you are not going to participate in Mrs. India, this is too much now, you're doing too much. So I was like, no, I'm going to do it, because for me growth, the passion for growth is always a very key driving factors, and I think it is you who is your biggest support. And mind is extremely powerful. Whatever you think you want to do, you always can do it. So this was one of my key resilient factors. I'm very self-resilient. I try to do maximum things myself. Now I am getting used to taking little help from others, but mostly I'm a person who doesn't like to take help, who tries to do everything on her own, and that is what I do all the time. So that can be sometimes extremely burdensome, but that escapes you from the burden of expectations, and you are very free. And the second thing about resilience is you have to be ready for failures and rejections. So many harsh comments, so many harsh things you will have to hear when you are after a big ambition, that maybe that any kind of ambitions. For my clinic as well as for my crown, I had to hear a lot of harsh comments. But then, when you have the conviction, then you are not affected by the opinions of other people. When you have that kind of belief in yourself, when you are going for big ambitions, for big projects, you need to be extremely anchored in self-belief, because if you are wavering, the world around you will make you sick. But if you are rock solid in your conviction, in your belief that yes, I am going to do it, then the world will not be able to shake you off. Because when you are going for a big project, the world is full of jealous, insecure people. They will obviously try to shake you off. But if you are believing in yourself, you know what you're doing, and there will be a lot of support too. But do not get swayed by both. You have to be anchored in yourself. So these are my tips of self-resilience. This is my inspiring story of clinic to crown. If you have a similar inspiring story, I would like to feature you on the Radiant Women podcast by Swayam Mind Clinic. I interview a lot of very inspiring women. A lot of you have a lot of inspiring stories sitting at your home, but if you are willing to share it with us, then please feel free to mail at swayamprava123@gmail.com. Thank you. Namaskar.